Like Lagos is being ravaged by an outbreak of cholera cause for serious concern. As the death toll rises, the outbreak has been linked to unregistered tiger nut drink in circulation. To curtail further spread, the Lagos state government has issued a warning to residents about the dangers of drinking contaminated or untreated water. The State Environmental Protection Agency, LASEPA, emphasized the importance of preparing food under proper hygiene, as laboratory analysis of water samples collected from various parts of the state show that some drinking water is contaminated and unsafe for consumption. Let's share the story by TVC News. Esther Mopariola with you.
According to the General Manager of LASEPA, Dr. Tunde Ajayi, a team of experts from LASEPA's ISO-certified laboratory is working with the Ministry of Health, the Ministry of Environment, the Public Health Emergency Operations Center, NGOs and other bodies to normalize the situation. Laboratory analysis of water samples from Odiolowo, Mushin, Kushofe and Lagos Island revealed contamination, making the water unsafe to drink.
As LASEPA, we have been in the center of this activity, of this outbreak response. We have gone to test water across town, across all local governments. We're currently out in Kushofe today. I think we have done Lagos Island, we have done Mushin. We have seen, different activity in the water people drink. And we have deliberately made sure that the infractions or the problems, the carelessness that cause these problems have been abated. People should not indiscriminately leak their waste or their sewage into drains, right, into gutters. If you leak it into gutters, your water pipes are flowing through the same gutters. Anywhere you have a burst, there will be a connection, and then you have the cholera from the sewage getting into the pipes, and of course you drink it in your house. So we're rolling out advocacy on it. We're continuing our testing. We're identifying places or clusters where we have issues, and then we're continuing testing in those spaces.
Mr. Ajayi also criticized some water retail outlets for unsanitary practices, noting that many borehole reservoirs were dirty and unkept, rendering the stored water unsafe. To prevent further consumption of contaminated water, the Lagos State government has provided clean water through tankers from the Lagos State Water Corporation. Affected boreholes will be cordoned off for treatment by the state government.
All right, gentlemen, Doctor, let me start with you. This is a serious case.
It is really. But let me say I'm confident that as it happened during COVID, the government will combat it. We'll be able to contain it. If you see now, people are becoming cautious. The way they eat outside, the water they drink. You hardly find people buying water just anyhow again. Before in traffic, you see people calling for water and all the rest. But it's changing. It's just that every time there is this escape from a major disaster, we get relaxed and we forget the rules. We get relaxed. We're forgotten that now, even when there is no disease, when there is no ailment, we should wash our hands frequently. It's something that the World Health Organization has been shouting about. You go to the toilet, come out of it, whether it's just, I only went to pee, does not mean you shouldn't wash your hands. We should always follow the rules. Yeah, it's important that we don't let down the guards. When I was told the figure was 15, I had my fears. But I knew that if 2 days after that figure doesn't double, then we're out of trouble. And it has not. Even till now, it has not reached 30. And that's over almost 1 week now. So it shows that conscious effort is being made by the state government. And I like the enlightenment that is going on across the country. People are talking about it. So it's in our consciousness now that we should pay attention to what we eat, what we drink.
I hear that, Dr. Bobikio. Do you agree with me that Lagos State government would have a lot of work to do? Because Lagosians don't joke with their roadside food, mama put and all of that.
Yeah, it's a continuous process. You know, one of the big enablers of cholera is open defecation. We need to stop this open defecation. Nigeria is the #1 in the world. We have overtaken India with all the population of India. A country of about 1.4 billion people. We are openly defecating more than them. It just shows that government needs to do a lot more. There are places where we need to site public toilets and we must enforce the use of the public toilet. Look at the beautiful Lagos-Ibadan Expressway. Look at what they have done to the medians. They gave us wide median on that road. They gave us wide median. But the wide median has become a toilet for people. If you are driving, especially in the built-up areas, like this Mowe, this place where they have the abattoir, Kara market, all those places, you see the way they are defecating, even in the open, in broad daylight, no shame. And nobody is apprehending them. And then flies will perch on their excrement and then go and perch
on their food,
on someone's food. Oh my God. That's how cholera is prevalent in places where there's contaminated water, you know.
Sanitation is
sanitation is generally poor. So Lagos State government has to expand the frontiers of its war against cholera at this time and come up with measures that are permanent. So that next year again, we don't find ourselves in this situation. Then the local governments where this thing is, there is a higher prevalence of cases, they need to attack those areas and send their staff to those areas and sensitize people. Because our people need to know that they are hurting themselves. What they are doing to themselves is not good. You can't be defecating in the open like that now. I mean, it's not pleasing on the eye. It's not what you want to see.
You don't care, or we care.
That's why the mama put areas are safer, because within town.
No, we can't stop eating mama put now. Because sometimes it gives you that
flavor. You can't
different flavor that your wife's food may not give you.
Corn and everything. All right. Before we speak with our guest, I mean, I don't know if it's ready. Let me come to you, Dr. Abike has talked about enforcement. Open defecation is not the only issue we have when it comes to this matter. There's also the issue of indiscriminate dumping of refuse. What level of enforcement are you expecting from government, even after conquering this?
Well, we've always had the law there. It's just to enforce it. Lagos State has said, see, you can't have a building without being registered with a PSP operator. Some people still get away with it. And that's criminal, really, really criminal. Because if you are expected to have a waste bin that is properly covered, not just something you buy and then you go and look for carton or, we should enforce these things. The laws are there. Let's make the state safe. It's important. I once had to eject a tenant because for 2 years we discovered they did not pay Loma bill. What were they doing? They were dumping refuse inside the compound, the self-compound, burning it, and then inside the house they turned the store to refuse dump. Inside the compound, they were doing the same thing.
Downright irresponsible.
I went to Loma and I asked the question. I said, somebody did not pay you for 2 years, and you did not raise.
All right, Dr. We'll continue that story after speaking with our guest. Joining us for more discussion on this issue is the General Manager of the Lagos State Environmental Protection Agency, LASEPA, Babajide Ajayi. Good afternoon to you, sir. Thank you so much for joining us this afternoon. Welcome to the program.
Welcome.
Thank you very much. Yeah.
All right. So let's start with the issue of contaminated water. How far have you gone with public enlightenment regarding this?
Oh, well, so the issue of contaminated water is something that ravages overpopulated communities. And for us, I think what we have done so far is to sensitize people on taking personal responsibility for the water that, they have to consume or that they have to use to prepare their food. So in the light of that, we have gone around communities one after the other. We have environmental officers in each of the communities, and people have been going from house to house, particularly in places where buying water is rampant and, where people fetch water from sources that are not very good. We're also there telling them about how to easily purify their water. I mean, simple things like boiling water, like using chlorine tablets that are easily available in every supermarket for very cheap, under 15 naira. All those things are simple steps that people can take, to purify their water before consumption and before domestic use. So, we are widening publicity. We are doing as much engagement as possible. We're speaking to community heads, religious heads. We'll probably be taking it to schools once they resume this week. And then hopefully we'll touch every fabric of the community.
Contact tracing is very important when one is confronted by this kind of dangerous and rapidly spreading disease. What progress have you made by way of contact tracing and getting these people to receive Medicare?
Oh, so on the health side of it, what I said earlier was the environmental side of it. On the health side of it, I know that contact tracing has been very immense. The Emergency Operations Center has been very active. They have, in fact, the advocacy we have and the extent of knowledge of the spread of cholera we have in Lagos today is because the health leg of it has been very efficient as well. So they have done a lot of contact tracing. We've brought more people into the net. From each of the hospitals where people have reported, we have identified those cases. We have traced them back to the source. From there on, we now take water samples and all of that. And people that have been treated of cholera have been treated for free. So I know that the health leg is very strong as well, which is like treating the effects of it. On the environment side, we're more about the cost, but I think both legs have been very efficient, and we have done extensive contact tracing. From the numbers we have, for instance, if you look at the numbers, we've probably seen over 400 cases or 500 diagnosed cases. But beyond that, there's been more than 1,000 plus contacts that we have established, and we have reached, and we have monitored so far.
Now, we read from some media outlets that the Lagos State government traced the source of this problem to tiger nut drink that our people consume. How did the government discover this?
How? So again, it's by contact tracing. So when you have a cluster of people who work in a certain place, come together to the hospital for similar concerns or for similar symptoms, then you trace it back to the last things they ate because their symptoms were vomiting, stooling, and all of that. So you trace it back to contact. Then you trace the contact, and then you find the actual thing that was consumed. So we traced it back to the tiger nut drink, and I think I had shared the picture of the tiger nut drink earlier. And I think the special advisor on health had said it on one or two platforms. How we traced it back to that tiger nut drink. It's not as much of the tiger nut drink as the water that was used to and the hygiene conditions. So we have chased it, and we're currently trying to track down the person. Unfortunately, there are no details on the label of the tiger nut drink. Just phone numbers, no addresses, no NAFDAC details,
wow.
And it's commonly at bus stops and public places where we can find as many as possible that we have found. We have actually our team, the environmental health team, has gone out to confiscate the ones that they have found. But tracing the actual factory is what we're currently doing.
Okay. What some of us expect is that you'll be able to trace the producer of this drink, ultimately. But let me ask, there have been reports in the past where, in some sections of the media, where we've complained about people defecating openly, and action has not been taken. Is it a lack of willpower or lack of manpower to work on this? Because it's an eyesore, seeing some of these things, not to talk of the health implications.
Okay, I get it. Open defecation is a big deal, and it is the core metric or the central metric that is used to measure sanitation in many parts of the world. I mean, let's say it's a globally acceptable metric to measure a decent level of sanitation. It is something that happens in many parts of the world, particularly around homeless people and people who just take things for granted. So in areas and communities where you have open defecation, you would notice a constant of population explosion. So you have those communities that are very closely knit clusters and they don't have proper sewage system and they just defecate wherever they find. As interventions, the state government has, we've done a few things in terms of, creating public toilets. So we have done a couple of that in the past. And also things around ensuring that, commercial facilities are able to open up their toilets to people who may need them. But I think more of it has to do with personal responsibility. It also has to do with, advocacy, a lot of advocacy around why you shouldn't do these things. So in many of those areas, like I said, people just throng in from different parts of the world and, of Nigeria. And you're not sure of which of them. So we can't plan for them, So it is only people you can account for that you will plan. And like we say all the time, when you are registered with Lagos State, when you're registered with LASRA, then we can trace and track. Then we can know where you reside and we can plan for the infrastructure in that area or for that area, or for that community. So I think more advocacy is what we will do. We would also, the Honorable Commissioner for Environment has said many times that we will continue to build public toilets, but also people have to take personal responsibility to use proper facilities when they are defecating.
Are you cooperating with or working with the Ogun State government? Because some of us noticed that the huge water around Kara, that's the long bridge now, flows into Lagos in and out. What are you doing with the Ogun State government? Because we know that part of
and the level of sanitation there is atrocious.
Horrible. Are you working with them? To get that sorted?
Yes, so we're working very closely with Ogun State government. As a matter of fact, 3-4 hours ago, I was in a meeting with the newly appointed general manager at the Ogun State EPA. And we're talking about how we can jointly, collaborate to sanitize those corridors. People take advantage of locations that are along the fringes. Those locations that, the monitoring in those areas sort of is in between, so nobody wants to take responsibility and everybody wants to take responsibility, that kind of thing. So we're going to jointly work together to make sure we clean up that area. It's an area of concern. We know that area also hosts one of the largest dump site, one of the largest open defecation sites around town. And it's actually the most open in terms of the most visible. You know what I'm saying? You're driving on the highway and you can clearly, easily see them doing that. So I think our collaborative efforts, which has started already, we started that a while ago, and we still had a meeting this morning to see how we can partner to strengthen enforcement in those areas and insist that they do the right thing. Sometimes these communities just need to be shown. So when you need to show them that you don't need, it doesn't cost too much to set up a simple sanitary unit. A toilet it doesn't have to be WC. The pit latrine that is properly maintained with a simple bowl up above it. It takes care of it. It is not all over the place, and it goes directly into the ground. So you can keep it clean and cheap.
All right.
Thank you.
All right, Mr. Ajayi, I think that's all we have for you this afternoon. Thank you so much for joining us. Babajide Ajayi, General Manager, LASEPA. Thank you so much for joining us, and we wish you the very best. Thank you.
Yeah.
Thank you.
All right, gentlemen, that's it from Babajide Ajayi. Final takes.
I think he has his work cut out for him. As a young man, I know It has the energy. This is their own baptism of fire. We had COVID in the past. We had Ebola in the past that tested the strengths of Lagos State officials. It's a big shame to associate this cholera epidemic to Lagos State, because they said that a coup for show. That's what. Right. To see that Lagos is actually the epicenter of it is something that really bothers me, and it's such a shame. But I hope that they will be able to rise to the occasion and defeat this problem.
All right, Dr.
Well, I also wish that the state will do more in terms of provision of water. They've been talking so much about expanding the capacity of the Lagos State Water Corporation. We know that sinking boreholes is not just expensive, but people are doing it because it's the only alternative that they have.
Yeah.
And a lot of these boreholes have been found out during this survey not to be as pure as they should be. So Lagos State should work more.
All right, gentlemen, Dr. Oladipo, Babajide, Kolade Otitoju, thank you so much for your perspectives.
Thank you for having us.
And thank you for watching, everyone. That's all on Journalist Hangout on Sunday. Join us tomorrow for the regular episode of the program at 5 p.m. You can watch the repeat broadcast of this episode tonight at 11:30. We are on YouTube at youtube.com/TVC News Nigeria. I am Olajumoke Olatunji. Bye for now, and God bless Nigeria.